Canal 1. Somos contenido.
Bienvenidos a su programa Health and Innovation, un programa que trabaja los temas de gestión de tecnología e innovación, ingeniería clínica en el campo de la salud. Welcome to Health and Innovation Program. This is an amazing initiative to promote clinical engineering, health technology management in health. I am very glad to welcome engineer Riad Farah, HTM certified with 30 years in medical engineering manager at St. George Hospital, University Medical Center, IFMBE-CED Collaborator, WHO Expert Collaborator, ACCE 218 Award Winner. Es mi placer tener como invitado al ingeniero Riad Farah, con más de 30 años de experiencia en gestión de ingeniería de la salud en el Hospital St. George, en el Centro Médico de la Universidad St. George, y es colaborador de IFMB y colaborador experto de WHO y ganador de un premio en el Colegio Americano de Ingenieros Clínicos. Soy Rossana Rivas, Senior Advisor del WHO Collaborating Center, y es mi placer darles la bienvenida al programa Health and Innovation. So Riad, thank you very much for this amazing opportunity to exchange a bit, and let us start with the first topic. One case of health innovation regarding COVID-19 in the hospital you can share with us in these hard and difficult times globally. Un caso de lección aprendida o de innovación en salud relacionado con el COVID-19 en el hospital que tú puedas compartir con nosotros en estos tiempos difíciles.
Good morning. First of all, I want to thank you. I'm so happy and honored to be with you and to speak with the clinical engineers and the people of Peru that I love a lot. We understand a lot that we have lots of common things together. Well, actually the COVID reunited the whole world. We as clinical engineers, we had to come up with innovative ideas to face the pandemic. And the COVID-19 came into everybody by surprise. So we can say that no one was prepared properly for the COVID-19. So one of the most innovative solutions that clinical engineers have to come up with is really to find out quick solutions to the problem, because the time was working against us. We didn't have time enough to be equipped properly. We didn't have time enough to change the facility and the architectural design properly. We weren't able to work in the normal environment. We had to work and come up with solutions under pressure and under stress. First of all, during the times of the COVID-19, the job of clinical engineers and the importance of the job of clinical engineers was very much clear, amplified, and everybody started talking about clinical engineering. Of course, doctors, nurses, and all healthcare providers are very much important. But before, we used to be the silent heroes. We used to be the silent workers. And now, because of the COVID-19, you start talking about clinical engineering, ventilators, training, adaptation. Well, I have so many examples of innovative ideas that we came up with. I will try to listen. I will try to list them, but I will pick only one and then concentrate it at. We had several problems of difficulties. First of all, the intensive care is too small and too little to adapt for the number of patients that we all had due to COVID-19. So one of the most innovative ideas in COVID-19 was transforming the normal patient rooms into an ICU rooms. And that's very challenging because we need to adapt the medical gases, the networking, the electricity, and everything else, and try to acquire and purchase new medical devices to transform the normal patient care into an ICU. That's one of the challenges. The other challenges would be is the how we can prepare isolating rooms and make the isolating room suitable for COVID-19 and for all types of infected patients. So now we understand that we really need lots of isolating rooms in different floors, in different levels, because the more we have isolations, the better control over the pandemic and over the contamination and the cross traffic between clean and dirty and all of this. But the topic that I wish, yes, please.
Oh yeah, we need to go ahead with the next topic, but I am very happy to realize how much important is this time for exchange, Riad. Efectivamente, el COVID menciona, el ingeniero Riad Farah trabaja muchos aspectos muy difíciles, muchos retos altos en el campo de la ingeniería clínica y de la salud en particular. Pero en el medio de todo hemos logrado saber, primero, que nadie estaba preparado, segundo, que el tiempo era infinitamente clave para elaborar respuestas acotadas. Pero si él tuviera que elegir dos aspectos o dos lecciones aprendidas, uno es el espacio que la unidad de cuidados intensivos tenía. En cualquiera de los países, en la mayoría, la totalidad, el espacio disponible en las unidades de cuidados intensivos era muy pequeño para la enorme cantidad de pacientes, interacciones que había que hacer. Y esto era un reto, el networking, la adaptación de toda la tecnología, la interacción entre especialidades y pacientes y familia, en fin. Ese fue cómo trabajar en los ambientes de la unidad de cuidados intensivos. El segundo aspecto y lección aprendida, para la cual era básico también tener una respuesta en COVID, ha sido la isolación dentro de las áreas en donde estaban los pacientes infectados. Esto era clave para no propagar la enfermedad y poder trabajar resultados acotados. Y en este desafío, la lección aprendida ha significado la creación de estándares que ahora se van a seguir en el caso del Líbano para el manejo de isolación efectiva en áreas de gran infección como el SARS, el COVID-19. Thank you very much, Riad. Let's go to the second topic. Share with us an insight for the adequate COVID-19 medical devices availability. I am smiling because we need to be positive in this pandemic, and medical devices they were always a challenge. Now in COVID-19 is a very hard topic. Share with us one aspect in the number of in the November WHO guide. You work on that team in this very important guide for medical devices in COVID-19 for WHO. Share with us one relevant insight about this. Por favor, Riad, comparte con nosotros un aspecto importante de este importantísimo documento que has trabajado para la Organización Mundial de la Salud, que es el manejo de dispositivos médicos esenciales para el COVID-19.
Sure. First of all, most hospitals and not all hospitals all over the world are equipped with clinical engineers. Not everybody have clinical engineering services available with them. So WHO prepared a very important book, which is a guidebook. It contains answers to the critical questions that we normally ask. We, at the start of the pandemic, we started asking ourselves, What are the medical devices that we should have at the ER? What are the medical devices that we should have for the triage? What are the medical devices that we should have at the critical care areas? What are the medical devices that we should have at the regular just isolation rooms? This is where the patient is quarantined. He doesn't need any critical care, so we need specific medical devices for them. So this guidebook gives a listing of medical devices so that all hospitals have the proper list, so that we are all equipped properly to face the COVID. So the information are shared with all. And not only this, we also need the specifications of each of these medical devices. We need to know what to purchase and what are the critical features without which we can offer safe solutions and safe services to patients. So that guidebook issued by WHO with the help of experts from all over the world, like yourself, you're famous in that as well. All the people participated in that issuance of this book, and the book contained all the necessary information for all hospitals in the world. As I said previously, listing of medical devices, specifications of medical devices, and it contains all the details necessary for us to know what to purchase to face the COVID-19. It's a wonderful book. I advise everybody to have a look at it and use it because it's for us, for the benefit of the patients all over the world.
Thank you. Yes, indeed. Riad habla muy claramente de cuál es el valor agregado de la guía de dispositivos médicos en COVID-19 de la Organización Mundial de la Salud. Se creó un equipo experto de diferentes partes del mundo solo para pensar en preguntas absolutamente claves en esta pandemia. ¿Cuáles son los dispositivos médicos más esenciales? Y siendo esenciales, ¿para qué tipo de proceso de salud en los países se recomienda tal o cual tipo de dispositivo médico? Pero no solamente esto, ¿cuáles son las mejores condiciones de uso, de calidad, de seguridad? Y luego la certificación, porque es importante que no solamente se use un dispositivo, pero también se use con la certificación y las condiciones de calidad y seguridad necesarias para la calidad de vida del paciente. Esto fue un trabajo enorme que ha sido parte el ingeniero Riad Farah en él, y él menciona muy gentilmente la contribución de varios expertos de otras partes del mundo en diferentes maneras. Mi persona, una de ellas, porque estamos en el mismo equipo de trabajo global, y recomienda muchísimo acceder a este documento en el que no solamente hablan de ingenieros clínicos, hablan de la labor y la interacción con médicos, con enfermeras, en beneficio de la salud del paciente. Este es un documento de libre acceso, está en la página de la Organización Mundial de la Salud. Well, finally, we have the cheer of the cake. If we think about leadership, clinical engineers leadership, Riad, what does COVID-19 give you as a lesson?
Well, honestly, I've learned lots of lessons. First of all, we clinical engineers, we understand now very well that we are playing a very important role in the hospitals and the healthcare services. We should tell the decision makers, and we should support the decision makers, and we should be part of the decision-making process. We can help the hospital administration, top administration, decide what to do, what to change. Can we admit COVID patients into the ER? Can we transfer the patient rooms into ICU? Can we accept more COVID patients? Can we do this? Can we do that? The clinical engineers should be equipped with information, and information is the key. Once we have the information, we have the solutions. And what hospital directors, hospital doc administrations want, they want solutions. So we know what are the requirements. We know what are the needs. We can link the dots between each other and we can offer these solutions. Leadership criteria is so essential for clinical engineers. I'm confident and I'm sure that you are, that clinical engineers are ready, are possible to be chief technology officers. They can be decision makers. They can be on the board of the executive board. They can be helping the top administration finding the proper solution, because medical devices is more than 30% of the importance of a hospital. It's more than 30% of the budget. It is so expensive to maintain. That's why our input is essential. And I'm sure that we can play a very important role and leadership. And this is what I hope for every clinical engineer in the whole world.
100% agreed. Muy de acuerdo. El último tema que compartimos con el ingeniero Riad Farah es acerca del liderazgo de los ingenieros clínicos en esta época de COVID-19. Y efectivamente, la lección más grande es que nosotros, los ingenieros clínicos, no solamente vamos a formar parte de la toma de decisiones, proponemos decisiones, estamos en el board de donde se deliberan las preguntas más fundamentales, las decisiones más fundamentales sobre políticas, procesos, estrategias relacionadas con esta pandemia y con el manejo del hospital. Él menciona muy claramente que esta pandemia nos enseña también a que la información es el activo más importante para que este liderazgo y este proceso de toma de decisiones y esta visibilidad, no solamente de la carrera, sino del valor que tiene la tecnología para la salud, se haga contundente. Nos brinda finalmente un número, un indicador. Más del 30% del presupuesto de cualquier hospital está basado en tecnología, en dispositivos médicos. ¿Cómo no pensar en la importancia de la ingeniería clínica, la importancia del liderazgo para el cambio en este contexto? I am very glad about this program with you, Riad. All the insights and the contribution was amazing. It were amazing, and I'm sure this program will mean a very meaningful contribution to the objectives of this program. Estoy muy contenta de haberte recibido, Riad. Tus reflexiones, tu contribución al programa está completamente alineado con el objetivo de este segmento. Health and Innovation está para contribuir a la salud. Final words from your side, please. ¿Algunas palabras finales?
I'm so thankful to you. I wish you all the best. I pray for better days to come, because it's a very bad time that we are all passing through. I understand what you all feel. We have instability as well. We have financial crisis. We have problems. I think we need to work together. We need to help each other with information, hoping that we can improve and elevate a little bit from the problems for patients. I wish you all the best. I'm so happy I can help a little bit, and I wish you all the best. You're doing a great job. God bless you all.
Gracias, Riad. El Riad Farah está muy contento de haber estado con nosotros en este programa. Nos desea lo mejor en los tiempos más difíciles que estamos atravesando. Está seguro que estamos todos alineados en el intercambio y en la colaboración para que las cosas sigan mejor. Está muy contento también de haber estado en esta reunión conmigo. Como dije, tengo el honor de ser parte del equipo internacional en el que estamos trabajando ambos. Thank you very much, Riad. Y quedo con ustedes muy contenta de haber compartido esta interesantísima sesión sobre tecnología, innovación, pero sobre todo innovación de tecnología aplicada al COVID-19. Ha sido el ingeniero Riad Farah del St. George Hospital University Medical Center con nosotros, y para nuestra próxima sesión los espero. Dennos sugerencias, envíennos sugerencias al programa. Estamos completamente atentos a la buena continuación de este segmento, y Canal 1 con la programación de alta calidad estará siempre con ustedes. Hasta luego.
Canal 1. Somos contenido.